Minka, Yeah, Breno, also there. And so, yeah, my whole few minutes now. Yeah, now for the doc, I'll be do Sweden now on start. Yeah, my hook a crab be next 3 to 5 minutes after the yeah, program. That's it. That was it.
Braided her hair about 30 days ago, and I wanted to show you our results. Look.
Jesus, you're here. Your Father who see, Yensu, hallelujah, oh, amen. I said,
Yo, abusuafo ye beda nyame ase. Ewo ne hweso pa ne bambo so nko a ode aboye. Ewie nso yetimi abedi ahyiamu a ye ba abehwe ye mpomude efo. Na adesua ye besua no American say yade ahuhia pa ma bema bia so ya kola so ye panyi. Enti se wo yo ba na wo so na okun wo nchen na on pay attention a twene gina wo nchen. Ana so bema bia wo ba bia afre no so metie bi. Additional yes, you know, sign also YouTube, any Facebook, Hope for Life before Airtel can say at the mic. And your two Safrobia, Mama Yembra, then you pomo dear home. Now, and you may, and I say, we Onipa Obedi and Nimuno, the Dean at the Dr. Samuel Amankwaa, sorry, Washington, Ghana, Maryland, Haya, I just said. Yeah, in your party. That should be a Hiana quiet, make a faka, a cofan so much first nova. Dogs over. Okay, well. Originally, no dog, no quite sorry, Toronto, Canada. Honor no call sorry, Ghana SDA Church. Now, dog echo school, University of Medicine and Health Science in St. Kitts and Nevis. And I'll move back Maryland, Hanum. For internal medicine residency at a C9 hospital in Baltimore. Now, doc, as an energy, and young pie, watcher and young back or cho as a major quite yesu. You too, as no be fusion, ever Bama and Sana within Jumedian. The doc, or the whole day, half a day, I can, you know what the boy, only the Oban Sana, what should Jumedian say. Na the media nyom ho pa na medical kan into obo ye osre se nyame moa no na ontimi ntro nyom dodo na emwa yempa na ade a ni je ho pa ne se abebia no obe provide health education for the ma community na se ntitru pa no ye ya hoho ye wokro hwai no so abesua apomodin ani ho adesua wokro hwai de obedum yensa nimdie na wanya no nti apomodin ho hyehye de waye krado pa se ye ton sa fe na no pa awia o obeba na wabedi yanim na wa cheche de ebeboa ye Dog, we idea First Nova Ghanaian Seventh-day Adventist Church at Yewo, Alexandria, Virginia. You know, you metropolitan Hanum. You mo akwaba. Na, as na bekasa no mame empe onyo no na afede ye fan twa na sansa na bakasa. Ti mo ma me few minutes bi.
Mango asubo fere ni mubido. Awawasam beni asam. Awawasam beni esretin sam dosu. Mango asubo fere ni mubido.
In the banity, Uma Yintina or Yip. Now, Lucy and Municipe na a figure mediano as ya. Yo, abusuafo enyomo no yan ya ti mu nsem pa shenkran. Awia adwumadi a yebeka ho asem pa no ya today say prostate enlargement, the cause, symptoms and the treatment. And yeah, me first akwanya na my introduce Dr. Samuel Amankwaa1st. Dr. First Nova sorry ni men's ministry ene e o ma bebre osoro nti me kan say First Nova sorry ina ye hye ye mo akwa ba etio
Medase say men's ministry day my inviting me say minimo be kasa kakra medamo say, and I thank you for your welcome and your hospitality so far. I'm going to share my slides, so if you could just give me a few seconds to make sure that works. Okay, thank you. Once again, Metro I said, me poto kakra, as we usually say it. My tree is not the greatest, but I will try to mix with tree in English. I think in penny for I can say, and here bronia or tree, I will try a little bit. Are you all hearing me fine?
ya we ado we to nka pa.
Okay, very good, very good. And so I was invited to talking about the prostate gland. The prostate gland, where bibi nyame wa bo mema mu. And so I'll be talking a little bit about it, about what is the purpose of the gland and what can go wrong with the prostate, and what will be some treatment management, and also what are some guidelines for screening for prostate cancer. So as I've been introduced, I'm a resident at Sinai Hospital of Baltimore. So my only disclaimer is that I'm not a prostate expert. I'm also not a prostate specialist. However, from what I know so far, I think I can give everyone a general awareness of the prostate gland and some diseases that are associated with it, and some things we can do also to prevent going into disease. Before we start, I just also want to ask Nyame Ankayin as we have this discussion so that it will go well. And Team Pamacha, let's have a quick word of prayer. Father in heaven, we thank you for this wonderful Sabbath day. At this time, as we talk about the prostate gland, I pray you will bless us all to take something out of it that will help us to have better lives on this side of heaven. Now let this time and yet time be fruitful with Jesus name. Amen. So the prostate or the prostate gland, same thing. What is it? Over here I have two pictures. Mostly it's the same thing. This is the male reproductive system, or Yebeka say Bama Bia when in reproductive system. Also, it is also, you can see said the reproductive system is also connected with the urinary system, or the kidney, bladder, urinary system. And if you can see my mouse, this is the bladder. This is the bladder in Obia, your kidney when the kidney makes urine, it stores the urine in this bladder. And then when we feel like say there's a small little tube or small passageway that they call the urethra. This is where the urine will be released from the bladder through the urethra and then down into the toilet. Now this little shape, this is what is the prostate in men. It is not present in women, it is only in men. Now the prostate surrounds the urethra. The prostate surrounds the little passage where the urine will flow into the toilet. And see, even right now, you can think, say prostate way, say, a home canwa, or say something goes wrong with it, then you can, Betimi Ahu said, then there's going to be a problem with the urinary system and the kidney system and the bladder system. And that's what we want to talk about today. Now, somebody may ask, say, what is the purpose of the prostate? The prostate serves as it promotes healthy sperm, basically. It promotes healthy sperm. It's able to secrete some fluid that will help Obama to be able to have healthy sperm, to be able to help produce children. And so that's the main function of the prostate gland, to produce sperm. Now, there are two major diseases of the prostate gland. Some of you probably already know this. The two are benign prostatic hyperplasia. Maybe Martino said is BPH, benign prostatic hyperplasia. Basically, this long word basically means enlargement of the prostate, enlargement of the prostate gland. If you see the second picture here, you will see that if the prostate gets too big, this is how it can look like. And so that's what we'll be talking about. The second major disease of the prostate gland is prostate cancer. Apart from these two, there's something else that's not very significant. Obroni Eberfriend said prostatitis. That's another disease of the prostate gland, which is mostly due to infection or inflammation, but that one is not too much of a high topic. So we will talk about enlargement of the prostate gland, and then we will talk about prostate cancer. So far, just to summarize where we have come to so far. Yahoo said the prostate is connected with the urinary system, and the purpose of the prostate gland is to help promote healthy sperm. So that's the normal physiology, Nyameyano. To say we're gonna talk about the diseases or what can be abnormal with the prostate gland. And see, we will start first with BPH, benign prostatic hyperplasia. Again, this means enlargement of the prostate gland. Very interestingly, as men grow in years, as we start advancing in our age, going into the 50s and 60s, it is normal for the prostate gland to get bigger in size. That is a normal pattern of life for men. The older we get, the prostate continues to enlarge and get bigger. Now, somebody may ask, why does this happen? And so for what we know is that the prostate gland gets bigger as we age in men due to hormonal influences. As we grow and grow, your 50s more, your 60s more, your 70s more, our testosterone level goes down, it decreases. However, there's another hormone that is called dihydrotestosterone. And this hormone goes a little bit higher as men age. And it has been thought that this is the hormone that is causing the prostate gland to get bigger as men increase in age. Now, not everybody who has enlargement of the prostate will have problems or symptoms, but some people do. And that's what we're going to review at this time. Inti se Obama ne prostate no gets it bigger and enlarged. What are some symptoms that the person may have? So because we know that the prostate gland is connected with the urinary system, it's most likely going to be urinary symptoms. So symptoms people may have is frequent urination. That is a very common complaint with people who have enlarged prostate. Frequently, they have to urinate and pee frequently. Especially at nighttime, they may wake up maybe 5 to 6 times per night just to urinate. Some people too, they have difficulty to initiate the urination process, and they have difficulty to also stop the urination process. This is a very uncomfortable and frustrating symptom that people experience due to enlarged prostate. Again, I'm gonna go back to the picture I have here. Who said prostate gland, if it gets too big, it's gonna cause compression on the urinary system, on the urethra. And so it will make it very difficult to pee. And when you try to urinate into the toilet, you will feel like there's still more that needs to come out. And you may feel unsatisfied with how much is coming out. Another issue is that if there is a blockage in the urinary system due to an enlarged prostate, this can lead to infection. There's a lot of bacteria that like to grow on urine if the urine is not passing out into the toilet. So if the prostate gland is too big and it obstructs the urinary system or it blocks the urinary system, this can lead to growth of infection. And it is possible for a man to develop something we call urinary tract infection, UTI. So those are some general symptoms that come with enlarged prostate or BPH. So, I want to just touch base on some warning signs that if an individual experiences this, they should seek medical advice as soon as possible. Any obema, for some reason, if suddenly you are not able to urinate, let's say for the whole day, 24 hours, Jonso biara embaye, that is a big red flag. It's a warning sign to seek medical attention. That is not normal. Other things that are warning signs is, let's say you have lower abdominal pain or abdominal distension, and you're also having difficulty to urinate. This is also a warning sign that something is going on in the urinary system, and it may be associated with enlarged prostate. Inti obema biase wuhu se maybe wofu ashe uchiya woya will waste so Emma will pains and also wuntimi injunsu yeah. This is a warning sign to seek medical advice as soon as possible because something may be going on more serious than you think. Also, if you ever see blood in your urine, as a man, that is also a warning sign that you need to seek medical advice as soon as possible to see what is going on. Now, there are some things that can cause blood in the urine or red discoloration to the urine. Something that's very common is the vegetable called beetroot or beets. Beets are very healthy, and sometimes if you eat beets, it may cause the urine to look red, but that is normal. There's nothing wrong with that. But when you say beta and you're having blood in your urine, it needs to be checked out. Other things that can cause blood in the urine can be infection. It could be kidney stones. There's also some medications that can cause some redness in the urine, such as medications for tuberculosis, or if somebody has a history of seizures, there's some medications that can cause that. Also, if somebody exercises very severely, so for our young people who may be on the line, if you engage in very rigorous, severe exercise, that may cause some redness to the urine as well. And another common thing is if there's trauma to the penis area, that can also cause it. But my main point here is that as a man, if you see blood in your urine, you need to let your doctor know as soon as possible. Also, I forgot to mention that some symptoms of enlarged prostate glands, such as going to the restroom frequently to pee, these symptoms can also be noticed in other conditions, such as diabetes. People with uncontrolled diabetes can also have frequent and very, very increased frequency of going to the restroom to urinate. And so that's another thing to keep in mind, that it's not only the prostate enlargement that can cause that, but also uncontrolled diabetes can cause that as well. Now, I want to talk now about the complications of enlarged prostate gland or complications of BPH. I've talked about it a little bit, but I will speak about it specifically now. If the prostate gland gets too big, it can cause urine obstruction, as I've been saying a little bit. It can block the urinary tubes. If it blocks the urinary tubes, urine will continue to accumulate in the bladder without any passage into the toilet. This blockage can cause kidney failure. This blockage can also cause urinary tract infection. And so those are usually the major complications of enlarged prostate gland. When it leads into obstruction of the urinary system, it can cause kidney failure and infection. Now, maybe there's somebody in the audience who has been told that they have an enlarged prostate gland. There may be somebody who is listening who may have been told that they have an enlarged prostate. I just want to give some encouragement or just give some reassurance that enlarged prostate gland or BPH, more so BPH, this is not a risk factor for prostate cancer. Mrs. Subium said, if you have BPH or if you have enlarged prostate gland due to this disease called BPH, this is not a risk factor for prostate cancer. Prostate cancer is a little bit different from BPH. BPH, the growth of the prostate gland in BPH happens more in the center of the prostate gland. And the center of the prostate gland is very close to the urinary system. And that's why people with BPH, they have symptoms right away. But when we talk about prostate cancer, the location of prostate cancer is different from the location of BPH. In prostate cancer, the cancer grows in the outside of the prostate gland. It's not in the center, it's in the outside. And so it usually does not affect the urinary system right away. For prostate cancer to affect the urinary system and cause obstruction or increase urinary frequency, that would have to mean that the prostate cancer is very, very advanced. But normally, that is why when people have prostate cancer, they may not notice it until it becomes very advanced, because the location of the cancer usually does not lead into symptoms such as having to pee very frequently or causing obstruction to the urinary system. I hope that is clear. So now, what is the diagnosis for enlarged prostate gland or BPH? If you think you have symptoms of BPH and you're thinking about getting tested, you want to talk to your doctor about it, what are the diagnoses that the doctor would recommend? And so there are a few things that can be done. An ultrasound of your pelvic area or an ultrasound of your prostate can be done to see how big the prostate gland is. So ultrasound. Also, there's something that is called digital rectal exam. This is when the doctor will lubricate his finger with a lot of gel, and he or she will pass his or her finger through the anus to get a feel of the prostate. It is uncomfortable, but it can help the physician to feel for the prostate and see if it feels enlarged or not. Another test that can be done is something that is called post-void bladder scan. Post-void bladder scan. Basically, this means that you will urinate, and after you urinate, we will do an ultrasound to see how much urine is still in your bladder. And if there's a lot of urine still in your bladder after you have urinated, that is a sign that there is some urinary retention, and that may be associated with enlarged prostate. And then the test that many of you may be familiar with is what is called the PSA test. Stands for prostatic specific antigen test. It is a blood test, PSA. It is a blood test that can help to see if the prostate gland is enlarged. If the prostate gland is enlarged, the PSA will be also high in the blood test. Now, if somebody has enlarged prostate gland due to BPH, what is the treatment or what is the management? To be honest, the initial management is what the doctor will call lifestyle modifications. And so as doctors, before we start people on medications, we try to do things on a conservative level. We try to see what the patient can change in their lifestyle through eating, exercise, and diet, to see what they can change to improve their disease. So some initial forms of treatment or management is, for example, if you have enlarged prostate gland, then it is advisable to not drink a lot of fluid just before you go to bed. And so limiting your fluid intake before you go to sleep, that will help with symptoms. Also, another thing that is helpful is avoiding constipation. Constipation can lead to more pressure on the urinary system. And so if you have enlarged prostate gland and you also have constipation, the constipation will make your urinary symptoms even worse. So if you know that you have an enlarged prostate gland, it's important that you move your bowels or you have regular bowel movements to avoid constipation and to avoid the extra pressure that your intestines can put on your urinary system. Also for young people, or maybe if somebody knows somebody who may be not Adventist, some advice too is that staying away from caffeine and alcohol can also help. Caffeine and alcohol can lead to increased urination, or it can cause somebody to feel like to pee more often. And so if you already have an enlarged prostate gland, that person should try to stay away from caffeine and things like alcohol. And then, like in any disease, exercise, good diet, keeping active, and keeping a good weight will also help with enlarged prostate gland. Now, for some people, those conservative management will not be good enough, and so they may need medications. Now, there are two popular medications that are used for enlargement of the prostate gland if needed. One of them is called tamsulosin or Flomax. Maybe some of you have heard about it, tamsulosin or Flomax. This medication helps to relax the bladder and the prostate gland. So if the prostate gland is too big, this medication can help relax it so that it doesn't cause urinary retention or the need to feel like you need to pee or urinate frequently. The side effects of tamsulosin or Flomax, sometimes it can cause some lower blood pressure. I think that is the major side effects, is that it can lower your blood pressure, but it shouldn't lower it too significantly. But if you're already on blood pressure medication, this medication called tamsulosin or Flomax can also lower your blood pressure. So it's something to keep in mind, especially if you're on blood pressure medications already. There's another medication to help with enlarged prostate gland, and they call it finasteride, or the brand name is Propecia or Proscar. This medication helps to shrink the prostate gland. It helps to fight against the hormones that are causing the prostate gland to grow. And so it helps the prostate gland to shrink to some extent. Now, the side effect of this medication, finasteride, is that it can cause some erectile dysfunction. It could also cause some decreased pleasure in sex or intercourse. It doesn't happen to everyone, but it's something to keep in mind that it can cause impotence or erectile dysfunction or decrease in the pleasure of having sex with your partner. So it is a side effect to keep in mind. These two medications do not fix the problem of BPH or enlarged prostate gland 100%. Think of it as it's like a Band-Aid. It's like a Band-Aid to just cover the symptoms. It will help to kind of palliate the symptoms, but it doesn't remove the issue itself. Now, let's say treatment with medications have failed. Then the next step to consider is surgical intervention for the enlarged prostate gland. That's usually the last resort if medications have not helped. In this slide, it shows the procedure that is usually done for surgical intervention for enlarged prostate gland. They call it the transurethral resection of the prostate. As you see the picture, it looks like it's uncomfortable. I assume that the procedure will be done under some anesthesia, but basically a very fine needle is inserted through the urethra of the penis, and then it is able to reach the prostate gland, and then the urologist will resect some of the prostate gland to make it smaller. Another thing they can do is that they can also compress it, or they can ablate it. They can maybe burn some of the prostate gland to make it shrink in size. So this is the last resort, and this is how it will look like if you ever go through this procedure. I hope not, but this is one of the more common surgical managements for enlarged prostate gland due to BPH. At this time, let's move into the second major disease of the prostate gland, which is prostate cancer. Prostate cancer is the most common cancer in adult males in North America. It is also the second most common cause of death in adult males. And it occurs usually in men who are over the age of 50. And it's also more common in Black Americans or African Americans. Now, I want to take a pause here because prostate cancer in and of itself is a very slow growing cancer. I repeat, prostate cancer is a very slow growing cancer. So if it is a slow growing cancer, then why should it be the most common cause of cancer in adult males, or why should it be the second most common cause of death in adult males? And research has kind of shown that part of the reason is that even though it's a slow growing cancer, when it is advanced, usually that is when symptoms are noticed, when it's in the advanced stage. In the very early stages, the symptoms do not declare itself. And so people who do not have regular checkups with their physician, usually African Americans or people of color, these population groups have poor follow-up care with their doctors. And so by the time that the prostate cancer has gotten really advanced, that is when they're probably going to see their doctor, and it could be kind of too late. And so that is something to keep in mind. What are the risk factors for prostate cancer? So obviously advancing in age. So as men grow older, above the age of 50, just getting older is one risk factor for prostate cancer. Another risk factor is family history. If there's somebody in your family, maybe a father, brother, who has had prostate cancer, it also puts you at a higher risk of developing prostate cancer. In terms of race, Black Americans also, that has been deemed a risk factor for prostate cancer. And for those who smoke cigarettes, that is also a risk factor. And also eating a diet of high saturated fats, such as eating a lot of meat, especially red meat and animal fat, a lot of dairy products. Those have also been associated with as a risk factor for prostate cancer. So what are the symptoms of prostate cancer? Again, initially, prostate cancer will not probably present with any symptoms because the area of the prostate where the prostate cancer begins to grow it's more far away from the urinary system. And so the individual may not notice any symptoms until the prostate cancer gets very advanced and very big, and then it starts to affect the urinary system. And so usually there is no symptoms until the disease status becomes very advanced. When the disease status is very advanced, again, symptoms can be the same as BPH, urinary obstruction, increased urinary frequency. And also, prostate cancer has the ability to spread to the bones, especially the spine, And so some symptoms could be back pain. It could be pain in your sides or around your waist. These are some symptoms that can be associated with it. What is the diagnosis for prostate cancer? We will talk about that a little bit more in the next slide, where I will talk about screening. But usually the definitive diagnosis or the major procedure for diagnosis is what's called a needle biopsy. Basically, this is where someone will put a very fine needle into the prostate gland and just take a small sample of the prostate gland, and that will help to diagnose whether there's a cancer there or not. What are some complications of prostate cancer? So when prostate cancer becomes very, very advanced, the complications could be urinary obstruction, similarly to BPH. I just mentioned that some complications could be spread of the cancer to the bones, such as the spine, and that can cause severe back pain. Also, it can cause erectile dysfunction depending on how big the cancer grows. Now, the treatment for prostate cancer depends on the risk of the disease. When someone has prostate cancer, as to what type of treatments they will receive, it really depends on how aggressive or how big, or it just depends on the status of the tumor. For some people, the treatment may just be, let's watch and wait. There may be no medications, no surgeries. If the cancer is very small, because prostate cancer is an already slow growing cancer, sometimes it may be recommended to just watch and wait and continue to monitor the tumor to see how it will progress. So for some people, observation is the only management in the temporary frame. For some people, it may be recommended to have radiation therapy. For some people, it may be recommended to have actual surgery. And for some people, it may be recommended to start on some specific medications or chemotherapy medications to help control the progression of the cancer or the tumor. One good thing about prostate cancer is that the prognosis is generally good if the diagnosis is made early. Again, because it is a very slow growing cancer, if it is found and dealt with quickly, the long-term prognosis is usually quite favorable. And that is what I have here in this table. And so again, I just repeat that if the prostate cancer is localized or it hasn't spread, it's not too big, the 5-year survival rate is almost 100%. The 5-year survival rate, meaning, living for 5 years with the prostate cancer, is nearly 100%. But when the tumor gets very advanced and it starts to spread to other parts of the body, like the bones or your liver or your lung, once the disease has started to spread, then the 5-year survival rate starts to be very poor. And then the prognosis also tends to be poorer once the disease status is more advanced. And to say, I want to share with you what are the guidelines for screening for prostate cancer. What is the FUTWO or the advice for how to go about screening for prostate cancer? I will be honest with everyone that prostate cancer screening is a controversial discussion in medicine. And the reason why there's some controversy about screening is because some experts feel like screening for prostate cancer routinely is unnecessary. And the reason why some experts think that is because they feel like more often that what will be found will be too insignificant, and we will just be stressing the patient, or we will put the patient through a lot of trouble with testing and procedures for a disease that is already very slow growing, and usually it takes a long time for the cancer to grow. So some experts think that it's not necessary to do a routine screening for the prostate because we may just be looking for trouble. However, some experts feel like if people are not routinely tested for prostate cancer, then they're under the risk of having or progressing to advanced prostate cancer. And at that time, the prognosis would be more poor. So at least at this time, why prostate cancer screening should be considered is because, again, it is the most common cause of cancer in men in the USA, and it's also the second most common cause of cancer death in men. And there is a benefit to screening in the sense that screening for prostate cancer can help detect cancer at a treatable stage so that you can reduce the risk of complications or dying from prostate cancer in the future. Now, how do we screen for prostate cancer? Nowadays in medicine, we do a blood test, as I mentioned before, that is called the PSA, prostate-specific antigen test. The PSA test, it is a blood test, and this is what is used to screen for prostate cancer. Generally, if the result is greater than 4, then there is some concern that we need to investigate further if the patient has prostate cancer or not. Now, this PSA test, it is a very sensitive test, but it is not a specific test for prostate cancer. And what do I mean about that? So the test, it is a very sensitive test for prostate cancer, meaning that if you do this test and the result, the number is very, very low, then that indicates that the patient most likely does not have prostate cancer. Again, if you do this prostate test, the blood test, and the number is very, very low, then that is very reassuring that the patient does not have prostate cancer. But the test is not specific. And when I say it's not specific, that means if the result comes back with a high number, let's say the number comes as 6, just because the number is 6 doesn't mean that the patient has prostate cancer. There are other things that can cause the PSA to have a high number or to be elevated, such as BPH, the BPH that we just talked about previously, and that we said is not associated with cancer. BPH in and of itself can also increase the PSA level. Also, if somebody has some inflammation or infection of the prostate gland, that can also increase the number. So just because the PSA is high doesn't automatically mean that the person has prostate cancer. So what do we do if the person has a high PSA? If a patient has a high PSA in their blood test, the next step is to do what we call a prostate biopsy. a prostate biopsy. And I have a picture of that here. This is where an ultrasound device will be used to locate the prostate gland. And then there is a fine needle probe that goes through the anus as well, I believe, to do a biopsy of the prostate gland. So depending on the results of the biopsy, that will determine if there is a source of cancer or not. So again, if somebody does the PSA test and the PSA is high, it doesn't automatically mean that they have cancer. But the next step is that your primary care doctor will most likely refer you to a urologist. A urologist is a prostate gland specialist. And then the prostate gland specialist will do this biopsy. And then depending on the biopsy, that will determine if there's any evidence of cancer or not. Now, the big question is, when should prostate cancer screening begin? At what age? At what age should prostate cancer begin? So some experts give different ages as to when it should be, but generally, I did the research for you, and generally, it's around ages 50 to 69 years old. Generally, starting from the age of 50 to 69, this is the age range where prostate cancer screening should begin. And as to how often the screening should be, also there is no consensus, or there's no 100% agreement as to how often that should be. But so far, some people may do it annually, some people may do it every 2 years, some physicians may do it every 3 years. So it really depends on the risk factors of the patient. And so that is what I want to talk about right now, is that with prostate cancer screening, as to when to do it and as to how often to do it depends on the risk factors of the patient. For example, it has been recommended that people who are African American or people who are of a Black race, such individuals, if they also have a family history of prostate cancer, maybe their brother or their father, then it is recommended to consider screening for prostate cancer even at an earlier age, maybe between ages 40 to 45 or 45 to 50. So again, depending on the risk factors, it may be recommended to screen earlier and to screen more often. It just depends. The benefit of cancer screening or prostate cancer screening, the benefits is that it reduces the chance of dying from prostate cancer. Basically, it will help to detect, it may help to detect to see if there is cancer. And so that is the benefits, that you can catch it early. But I'll also be honest with you that there are disadvantages with screening for prostate cancer. And that is why it is a very controversial discussion in medicine. So what are some of the disadvantages of prostate cancer screening? One of them could be false positive tests. False positive tests. As I just mentioned before, the blood test that is used for screening, the PSA test, it may be elevated in other diseases such as BPH or infection. And so it doesn't necessarily mean somebody has prostate cancer if it's elevated. So because of that, sometimes people may undergo unnecessary biopsies, or they may go unnecessary surgical procedures for prostate cancer. And lo and behold, there is nothing there, or there's nothing significant to treat. And so another disadvantage of prostate cancer screening is overdiagnosis, something we call overdiagnosis. What is overdiagnosis? Overdiagnosis is diagnosing prostate cancer that never would have been a cause of symptoms, or that would not be apparent if the person was not screened. So again, overdiagnosis basically means that is a disadvantage because sometimes people may be screened for prostate cancer, and maybe they may do a biopsy and they may find a little small area of cancer, and then in the long term, because it's a very slow growing cancer, it may not cause any symptoms or trouble in the patient's lifetime. The patient may even die from a heart attack or diabetes, or may die from natural death and not even due to the prostate cancer. And so that is why some experts feel like routine screening of the prostate for cancer is unnecessary, because sometimes it may just be that we are looking for trouble, we are looking for things, and if we find it, maybe it's very insignificant, and maybe it's not worth putting the patient through so many procedures for something that may not cause any trouble in their lifetime. I hope that is clear. If there's any questions, we can take up questions on these at the end of the presentation. Also, there are also complications with prostate cancer screening in terms of biopsy or even doing surgical management for cancer. So complications with biopsy or surgery can be, sometimes this can lead to erectile dysfunction. For us, say to collect something from the prostate is a risk. It can cause infection, it can cause injury to the reproductive system of the male, so it can lead to erectile dysfunction. It can also lead to urinary incontinence. It can damage the urinary system so that the man loses control of being able to urinate, or to voluntarily control how you want to urinate. And so, it can cause somebody to urinate and when they don't want to. And so that is called loss of control of your urinary habits. These procedures can have that complication, and so that has to be kept in mind. And so overall, I think I would summarize that prostate cancer screening is a conversation, or it is a discussion that should be held between the patients and their primary care doctor. And both of you as a team should consider what are your risk factors as a patient, and if it is worth to do the screening or not. Again, risk factors: is there family history? Are you African American? Well, the answer will be yes for us. We are all people of the black race. And so when it comes to screening, it is more of a discussion. It's a little bit different from other cancer screenings, such as colonoscopy. Colonoscopy is a screening where we screen for colorectal cancer at the age of 50. And usually that is something that is more kind of automatic or more easily recommended. But when we talk about screening for prostate cancer, it is more of a discussion that needs to take place between the patient and their doctor, and basically discussing if it is worth it, discussing the risks and benefits, discussing the benefits of doing the screening and the disadvantages. And so it is a shared decision-making conversation. So I think that's where I will leave it at that it's a conversation that should be going on between both parties, the doctor and the patient. What are some health tips to help against prostate cancer? So some people have done some studies on diet, and they have found some association of some foods that may help against prostate cancer. Now, even though I'm going to share this with you, I want you to know that more research is needed to confirm these assumptions or these associations. But so far, there are some studies that suggest that some of these foods I'm coming to talk about, or vegetables, may be helpful against prostate cancer. One of them is cruciferous vegetables such as broccoli and cauliflower. Some studies have shown that these vegetables, broccoli and cauliflower, are helpful against prostate cancer. Also tomatoes. Tomatoes have an ingredient called lycopene. Lycopene. It is a very strong antioxidant, and so it has been studied to be associated with a benefit against prostate cancer. Again, more studies need to be done about this, but so far from what we know, tomatoes have been suggested to be a beneficial fruit for prostate cancer. Also, vitamin D there's been some studies saying that vitamin D is also helpful in the prostate health. And so vitamin D is good to get sunlight. Maybe once in a while you can have your doctor check your vitamin D level to make sure that is in a good range. And it's good to get good sunlight, go outside for a walk because sunlight also helps in the development of vitamin D in our bodies. Also, soybeans or legumes have also been studied to show some benefit against prostate cancer. Soybeans, or maybe things that are made out of soybeans. Some experts have noticed that people from Asia, men from Asia, they have noticed they eat a lot of soybeans, and prostate cancer is much less often seen in these men compared to black men or Caucasian or white men. And so because these Asian men eat a lot of soybeans and prostate cancer is not as frequent in that population, some experts have made this assumption that soybeans may also be helpful helpful against prostate cancer development. But again, there needs to be more research about this, but I think all these things are healthy vegetables or foods we can include in our diet as men. In everything, do everything in moderation. Just because I'm sharing this with you, it doesn't mean that you need to eat soybeans for breakfast, lunch, and dinner. But just take it in moderation and you can introduce it in your diet because there has been some suggestion that it may be helpful for prostate health. My closing remarks on the prostate gland is that, again, God made the prostate gland because it is a gland that promotes health of sperm, and it is helpful for the reproduction of basically, to help produce babies. I'll just put it like that. So that is the purpose of the prostate gland, to help promote healthy sperm. It is a very natural phenomena that as men grow or as we increase in age, as we get older, the prostate gland begins to get larger or it gets bigger in size. For some people, this may not bring trouble for them, but for some other men, it may cause some symptoms such as urinary retention or the need to pee very frequently. And some of the worst complications is that it can lead to kidney failure and infection. And so if you have these symptoms, there are lifestyle modifications, there are some medications, and there is last resort surgical procedures that can be done. So you can talk about this with your primary care physician, or you can ask for a referral to a specialist who is called a urologist, and they can help you manage your enlarged prostate if it's causing symptoms for you. Also, in terms of prostate cancer, again, prostate cancer screening usually will be around the age 50, but it's not an automatic screening. It is something that your doctor and you as the patient need to talk about and consider the risk and the benefits. And if you all agree, then you can proceed with the screening. And in terms as to how often you do it, again, that can be a conversation that you and your primary care doctor can have. So thank you for listening to the presentation. I hope we have learned, or we have more about an awareness of the prostate gland, the normal physiology, the abnormality, and what are the guidelines for screening. If there are any questions at this time, I'll be happy to entertain them. Again, I'm not an expert, but from what I know, I will do my best to answer your questions if possible. Madam Wasif.
Yo, Doc, also yeah, that was a far. Suafo ordinary wasi. Sembusa ne mmoa bi a wo no obetimi e de aba ye wo break akra wo yanim. Obetimi de sembusa ne concerns bi aba. Na ja Doc wa haide nanka wa my directions kakra na ya hwa de. So bia wa sembusa obetimi e de aba. Na asa na obi bebe mu no ma mindi kan busa we. Obusa also nye expert what they say there, but here saying a matter, we name there, I don't know how true it is. So the entire prostate, glance get a say from at the age of 50 air corner, say nipan be year inactive, be year sexually inactive at that age, I don't know how true it is. When you say, oh, home, a crowd, yeah.
Yes, thank you. Yeah, I think that is a concern some people think, but the major reason why the prostate gland gets bigger with increasing age is because of hormonal influences. So again, there's a hormone called dihydrotestosterone, and as men get older, that hormone has a stronger effect on the prostate gland, and it causes the prostate gland to get bigger in size. In terms of activity, also if somebody doesn't engage in regular exercise, debia or tifie, they're gaining weight, they're getting obese, they're overweight, all those things doesn't help. Again, also eating a diet of high animal fat, red meat, a lot of dairy products, all of these are not helpful. So I think the main reason why the prostate gland gets enlarged is because of the hormone changes. That is the main issue. In terms of the sexual parts of not having intercourse, I'm not really sure that that is a cause.
Yo, doctor, that's a bit brain. I have a question. I control measures. Not just say Chinese for flaxseed in there. Our seed in Bonogam, sunflower. Sunflower seeds and other seeds. A boy with a prostate. And I don't know how far that is true.
Yeah, thank you. So far from my research is that the soybeans is what studies have shown to maybe have some benefit against prostate cancer, soybeans. And then interestingly, people from the Asian culture, these men, they usually consume more soybeans than people in North America. And in this population of the Asian men, they also have a lower incidence or a lower rate of prostate cancer. So it's been hypothesized that at least soybeans may be helpful. In terms of flax seeds and other seeds, I haven't come across that yet. Only the soybeans, but even with the soybeans, research still is needed to confirm that. But so far from observation and studying the Asian population men, so far there's some suggestion that the soybeans may have a beneficial effect for the prostate.
All right. Thank you so much.
You're welcome.
So be was same be say be a bit aba.
Yeah, I'm saying, bruh, I'm on for you question. Normally, from experience, we did from 50 going now. Say, no doctor will come. We don't saw ya, not June saw the review. Not June saw the review, sir. As I June saw Nebia. I feel a better lifestyle. Now cast all that, a payanka, and lumen so be brave. Ukakwadana jua. Maybe you can stop drinking around 8 p.m. or whatever. Uja nsuo nom na bɛboa wo ndwonsɔndwonsɔ anaasɛ by your genetic from that age you experience that dwonsɔndwonsɔ for a long time. So is there like a control measure? Yeah, best stop for anaasɛ we just have to live with it for the rest of our lives.
Thank you for the question. So What you're saying, I understand. It's a frustrating part of a man's life when we start to transition to this stage where the prostate gland is enlarged and we start having symptoms. Again, some of the things I mentioned is only like a band-aid. For example, say obi pran and they put a band-aid over the sore. The band-aid doesn't take away the pathology. The band-aid doesn't take away the wound, but it just kind of palliates it. And so things like not drinking fluid just before you go to bed, things like that are just a band-aid to kind of cover the condition. Even the medications that are prescribed, like the tamsulosin, the Flomax, the finasteride, those are, they're like band-aids just to palliate or help combat the condition to a point where the individual can at least have a good quality of life. And so if somebody is having to urinate a lot during the day and during the night, if they're on medications, maybe a subit tikrakra to the point where they will at least have a comfortable lifestyle. For some people, the medications may not even work, and so they may need surgery. And so surgery may be the permanent control for enlarged prostate that is causing a lot of symptoms of poor quality of life. And so for some people, they get very frustrated, and surgery may be what they want to do. Now, obviously, surgery also has its risk. Surgical procedures of resecting the prostate, it can cause impotence, it can cause erectile dysfunction, it can also damage the urinary system. So these are all risks and benefits, advantages and disadvantages that have to be discussed with the urologist and the patient.
Department maps a question. I'm not telling you, department maps a question.
I don't wait to be surprised. Hey, and yeah, man, yes, yeah.
That's it. Well, no, because I say, say if you have a family member, I say if your father or your uncle have it damaged, or you are prone to have a chance of having is very big. And I also can say, doing the yearly check, a debate the cost to war system. What do you think? Uncle and say uncle yearly and now say. What is your take on that? Say, on train, no, 59 now say, uncle before 40, because of the history now. Maybe the past father or the uncle. What is your intake on that? Say, if it's a good idea for the person to go and check at any age.
Okay. So did you say that the person has a history of prostate surgery already?
No. His father and then his father was died from prostate cancer.
Oh, okay. Yeah, thank you for the question. I think it reinforces what I was saying in the presentation, that in that case, the recommendation is that as a Black individual, if you have a family history of prostate cancer, whether in your brother or in your father, and that person had the cancer at the age of 65 or less, then the recommendation is to consider prostate cancer screening even at an earlier age, maybe between 40 to 45. Between age 40 to 45. So I guess the question will be, at what age did the person's father, at what age were they diagnosed with the cancer? If for sure it was at an age of 65 or less, that is a very strong risk factor. And so the person you're talking about would have to speak with their primary care physician to consider if prostate cancer screening should be done earlier. So far, the recommendation is if you're Black and you have that family history of someone with prostate cancer at an age of 65 or less, then it is recommended to consider or discuss with your primary care doctor early screening for prostate cancer between ages 40 to 45.
So his dad died at 75, but now can we say the side effect and also the disadvantage of it, can be you can lose your manhood. I mean, a lot of side effects in war. It's in what you think. Is a good idea, because some of the doctors are doubting it and some would say go ahead. You know, your position, what will you do? What will you tell your patient to do?
Yeah, it's a very strong feeling there. I understand. So yes, there are risks to procedures like this, and so the person can speak with their primary care doctor about it. Maybe they can do a general blood test like the PSA test, and then if they do the blood test and the number is in a safe range, then they don't need to worry too much. Again, even though it's recommended to consider early screening with this family history, it doesn't mean it's automatic that the person needs to do it. So it's still a discussion about the risk and benefits, and then at the end of the day, if you read the literature, at the end of the day, the decision even is based on the patient when it comes to prostate cancer screening. So from my thinking, I think maybe they can start off by doing the blood test, the PSA test, and then based on those results, they can move forward. If everything is okay, then thank God. If not, then they can be referred to a urologist to continue to talk about things.
So much.
Okay.
You're welcome.
Me more kakra bi. Me more kakra. Me de boa wo question back kwa Elijah Busaye no. I said dodo na no I say a rumor na saying say mpendodo a no oba beda na say those people mo sexually active no mo na omunya prostate cancer. Anya no kre no kre sa de say na nka rumor father fo nyina na nkomu nyina wo bi. Ade wo mu nyina aye say even me hormone na kasa na ye testosterone no. Eno no na your friend is say prostate cancer no na say tumor. Either prostate cancer na say any benign tumor na say malignant tumor no omo rely for their growth. And also so hormone no aye testosterone and na ma bema ye bema. Eno ntim pokra no hormone your friend say therapy na ya na omo taking drugs no much hormone your friend say omo taking no. Eno no eboa ma sa male hormone produce more. So the be ya a bit me drug a bit me a control your friend say the cancer. There's a hormone produce next cancer na emma next say no say wow be sex do no never ma cancer na akọ enya no kore just saying keke na yen fancy ya adwunu mo say they now doctor e kan ankasa no black race any some of the activities in me bia ye post here na say e cause ya de na no na say you be making sure say you betimi you be prevent especially near ya ankasa you betimi aya you will be a home ultimate genetically or family. But yeah, some of optimistic be a bit me I never bit me as sees in one acquire yes say or BP or family. And I was about better. It's a dependence obey. What's all to start the damn so? I was making sure say and you may be a bit more BP no pressure and bit a panel. I was so free sign menina. It just says, "Oh, say be your family no. Say prostate cancer woman. Up to you. Say, making sure say, and you may be a bit me one more prostate cancer in term no. I was what it is to sign your money in so near yes, Anna, and also bit me abo. And yes, I need money that's a 2 year. And you need me ask him. Anna Bakuzo question Bakusa woman Ebusai no. And yes, sir, your friend is say, I've forgotten the question later to me that's being.
Okay, maybe one question could be Anna. I think I am more confusing when it comes to the issue of urination, going to the bathroom regularly and those things, I'm not independent to me who exactly what is it? Is it because of the water that we drink, And you may say a sign of prostrate. A regular we expect that the person should be going to bathroom regularly. But here's the case: every prostrate, you can't go bathroom. That the match is a sign. Which is which? Is it a sign say when you're prostrate, and answer is because of the water you be taking?
My
Thank
mentor,
you.
you can answer Dr. Abem.
Mhm.
I'll be Dr. Abem. Me father you will be a onum super. In fact, no so part to the sense I want to care Mokaya now so always she's going to the bathroom. And to call France, no, no, check in prostrate. In fact,
prostate was very, very enlarged. Very, very enlarged. I don't know much I can also benign. There's nothing in there. So no, I'm at the age of almost 70, 78, almost 80 years. No, he has a very large prostate. We only need to care more, or just like a crabia, 5 minutes, 2 seconds. Now, could be. That is what it is. I am saying to say, maybe the doctor can contradict me. The first year, you should be in chest a year war. Prostate and I alarm be or say, no, be alarm of yourself, and I say, yeah, yeah, free. I say, Mr. Anopa, me just to be brand, that is a prostate cancer. Water intake, a very, very, although it might be a bandage to the situation, about 7 o'clock, yeah, minimum show you. Send a bear, no coda meeting ya day. I know in Chile, if I have it, means you know, man, no, and I say, so I just wanted to put that out there. So the fact say, woke up from an adjournment to be an actual to be, it doesn't necessarily, you might have an enlarged prostate, but it doesn't necessarily mean, say, cancer. So maybe a doctor for more.
Thank you very much, Midase, for Humano Abua. I agree. Said Obama or Junso Pino doesn't automatically mean they have enlarged prostate. And I'll give you an example. If there's a young man who's 23 years old and he's complaining, say, oh, Junso too much, I'm not going to be thinking about enlarged prostate in a 23-year-old who is peeing a lot. I may be thinking of diabetes, right? For somebody who maybe has heart failure and they're on medications to remove fluid from their heart or from their lungs, we call them diuretics. That person too may pee a lot because of medications. And so when it comes to the issue of frequent urination or having to pee very often, again, it's not only the prostate gland that can do that. And so as a doctor, the doctor has to do a very good investigation to determine what is it. Is it diabetes? If the person is old in age, is it the prostate gland? Is it medications? At the end of the day, water is good. And so I wouldn't want to discourage anybody from drinking adequate amount of water per day. It is recommended for us to drink about 6 to 8 glasses of water per day, unless maybe there is some medical condition like maybe kidney failure or something that the person cannot do that. But otherwise, it is very important that we drink a lot of water. For somebody who has enlarged prostate gland, water is good to drink, but the person may have to be careful as to when they drink their fluids. You definitely don't want to drink it just before you go to sleep. Or maybe if you are an elder and you have BPH, you probably don't want to be drinking a lot of fluids before you go on the pulpits to preach or something like that, or before you go in the plane to travel, because how. And so those are things we have to keep in mind, that not every person who pees a lot is not always due to enlarged prostate. It can be due to other things, and it's very good to drink water. And something I will say about water is that if you are somebody who urinates and your urine color is brown or is very, very yellow, that is a sign that you need to drink more water. Whenever you see that your urine is very concentrated, very dark, very yellow, very like brown color, that is a sign that your body is telling you that they need water. So just keep that in mind. And I agree with what Openi Kai, you know. So yeah, if the question is answered or not answered, please let me know.
You go so I try more questions. This will be more questions if you are waiting with them and now contributions.
And in soon so no said they're not Dr. Ekano. In Sudo Obenum, no, any general Johnson, but Johnson. ɛno nti sɛ nnɛ yɛse menom sɛ menipadua no fees yɛwɔ me nipadua menom bi a bɛyɛ 2 cups anaasɛ 3 cups anaasɛ 4 cups na ɛboa me a mehu sɛ me dwonso no ɛnyɛ yellow a wonom ma ne ɛboro so a de bia wonom no a wobɛdwonso because your body may offer be homeostasis, ability of the body to maintain the normal balance. And when you know say a follow do a boro near a fan so the aboro swinging and also free. Also you go up on 10. And when you know say one so man bro so Uba Johnso, Uhan Wadronso, Uhana Johnso, what's a what system say, and then manum so more than expected than say a normal water de be our own body fluid. He said, you won't me de be our own. I will do so man a brosa. I was so bizarre. Maybe I teach him how many pedium. And she was a me come a pomodin for a national doctor for no million. It's said, in sure a menum no, said the menum no dano, and one a menum. And so, and no man on Sosa, and I made John Sosa, Ben, and now what you mean, and the Yam Johnson Missicon, Mentiasia. And no, the nature say, BBS, I was out on Hocotre a pomodin for no more at the claw. I see. Dehydration. So one so be breba, a manipadua kidney craft feeling. Was a essay. It's I say, or sign a maximum of insu nasa water, a bit me a regulate the body system or heart, a blood and insu. It is say, even because when you so do not a bear affect your heart because the whole kidney heart, I don't know, make it transfer to the kidney. And no, you make sure say benum so de bia to the maximum on your body no expecting, but shouldn't be excess. Onum so be breba, ubadun so be brebe, ujun so be breba, and fan sure me say ade. E beba be ye ade, e bra wa hu say inum so be bre, na mum no be dun so more than said me body no ECCT no, and the was so ko hu apomeden for me da.
We name it that was there. So
Number of question I made was does exercise over a bois your prostrate nana? Does that help?
thank you, Uncle Fred. The answer is yes. The studies have shown that regular exercise, being active, healthy lifestyle, people who do that, their prostate health is much better than people who are overweight, obese, and they don't exercise. So to your question, the answer is yes. The more regular exercise and activity we take, it will for sure help with the prostate health.
Then me was that question is who need do 50 air corner. Not your full yakaseba. Full has say yakaseba sada. Mom, your doctor, I'm more say I will lose 2 inches kakra on a messenger. A man, you share the yakase. Now, and no, does it have anything to do with the prostate? And I think I'm remember exercise in a bois. I was on one.
Yes, the answer is absolutely yes. Yes, even the same things that will be recommended for like cardiovascular health when it comes to the prostate is, it has shown to be the same thing. So yes, the more activity. I know as we get older, it's a little bit difficult to do more rigorous exercise, but as much as you can do to break a sweat and to see that your heart rate is beating faster, about 3 to 5 times per week, at least half an hour, those are all, that's good. So the answer is yes.
Yo, 24. I say, no, minim. So be more questions and answer contributions. Obi kasa. Yes, sir.
I'm who said prostate enlargement, na mete so obi cause a lack of sex. Etimi emma prostate no enlarge. Intimi pese mi hu
Yeah, thank you. I think this question has been coming up. To be honest, in all my learning and all my training, I've never heard of this, that more sex or lack of sex, is a factor for the prostate health. What I know is that just regular exercise and being active is what's important. So maybe I will have to come back to you all with that, but so far I'm not aware that engaging more in sex or not, that is a problem for, or that should lead to prostate cancer. I'm not aware of that so far in my training.
Main contribute kakra. I'm sorry, I did this presentation about 2 or 3 years ago. I came across two studies beyond my normal sex preventive prostate cancer analysis. Sex, Emma, so too many sex, and I said too fewer sex, and prevented the enlargement of the prostate, The enlargement of the prostate there has nothing to do with sex. Then physiologically, or prostate never enlarge. But what studies consider and say whether it's a risk factor for the enlargement they be progressing into prostate cancer or not. There were 2 studies, back also supported, back also we are against it. And it's well, these are some areas in here more research. And as people dedicate more research into such areas, and maybe say here enlargement in the emphasis sex prostate gland and enlarge and the emphasis sex it has more to do with age, any hormones, any of the that's.
And I want to just re-emphasize a point I made that prostate enlargement secondary to the BPH. Again, I want everyone to be reassured that that is not a risk factor for cancer. So again, a lot of men have BPH. A lot of men have enlarged prostate secondary to BPH, benign prostatic hyperplasia. So if you have that condition, I want you to know that so far from what we know, it is not a risk factor for prostate cancer. So if you do have that problem, I want you to have peace of mind that it doesn't mean you're going to develop cancer. Prostate cancer, again, the location of prostate cancer is different from BPH. So I just hope we will keep that in mind, that BPH is not a risk factor for prostate cancer.
Doctor, but one question here. Does testosterone has any effect on our yana? And if it does, what can we do to increase it?
Yes. So the interesting thing with so as we age, as men get older, above the age of 50 years old, the testosterone level drops or it starts to decrease. However, there's another hormone that is called dihydrotestosterone, and that is the hormone that is causing the prostate gland to increase in size. So for your question in terms of the testosterone being lower in older men, and how can we improve on that? At least right now, we don't treat men with testosterone for their BPH or enlarged prostate gland. It's against the physiology. So if a man's testosterone level is decreasing, it's a natural thing. And usually the problems with that is more with sex drive or erectile dysfunction. Those are more complications or symptoms of the testosterone decreasing with age. So that's a little bit different from enlargement of the prostate. And so that's a separate issue. In terms of what to do in that case, it depends on how bad the symptoms are. If someone has low testosterone to the point where, their sex drive is very poor, they have erectile dysfunction, sometimes it can even lead to anemia, then that can be some grounds for testosterone replacement therapy, where some medications can be prescribed for that. But that's a little bit of a different topic. If a man's testosterone is much lower than suspected, the doctor also has to research as to why, or investigate as to why this is happening. It's a little bit more complicated. And usually at that time, a specialist called an endocrinologist, would have to, the patient would have to be referred to an endocrinologist. So again, low testosterone is different from the prostate gland. But if somebody is symptomatic from low testosterone, as I just said, erectile dysfunction, loss in pleasure of sex, anemia, then that can raise some suggestion or indication for hormone replacement therapy.
Thank you.
Okay. Eda mo nyinaa ase. Hwɛ sɛ yɛbɛnya more questions ne contributions na so number 5.
Yeah, I just wanted to add a bit.
Okay. Yeah, go ahead.
Hello?
Go ahead.
I just wanted to add a bit.
Okay. Yeah.
Yeah, I just wanted to add a bit of contribution to it. I see a lot of people, they're fixated on about sexual activity and how that might help to that your prostate won't enlarge, but it's human nature. It's like women at a certain age, like by 50, we start to lose our estrogen. We have menopause. The same thing with men. As they grow, they start to lose their testosterone, starts to decrease, and another hormone will come, and that hormone is what's enlarging it. It's not that if you can do sex more or not, because even reality as men, as you get old, your sex drive is not increased. If you have sex one time, your body cannot have it right away. It takes hours for you to rejuvenate. So therefore, sex cannot contribute into your prostate to continue to be regular. So it's just a human nature. As you grow, things decrease and other stuff increases. The same with women. As we grow, we have menopause. Our estrogen decreases, and the same with men. So that's why your prostate is enlarging. It's because of the decrease of your hormones, the testosterone, and your increase in your other hormones. So it has nothing to do with any sexual activities. So that's what I will want to contribute to.
Thank you. Thank you very much.
Thank
for
you,
your
Naomi.
contribution.
Thank you.
And also for contributions now, dear Bana. Yeah, we wrap on the up around say 50 now boy 450 by 5 for the yeah. I'm saying doc workers are now cut test, you know, so my 3 different tests, you know. She see if I say my bow on China, maybe so say the person we call it prostate gland test now. Then I'll be recommend them, mommy.
Yeah, so the first test starts with the blood test, the PSA. So regardless of family history, risk factors, the initial test for prostate cancer screening is the blood test, which is called PSA test, prostate specific antigen test. That is the initial test that will be done. Based on the result of that blood test, that will determine if everything is okay, or if the number is too high, then your primary care doctor will at that time probably refer you to a specialist, a urologist, who will consider to do a biopsy of your prostate to rule out prostate cancer. Again, it's going to be a discussion, it's going to be a conversation about the risk and over the benefits. Also, you know, interpreting the PSA test also depends. Does the patient have BPH? Maybe the PSA is high because of BPH. So these things have to be looked at. The risk factors have to be looked at. But if the PSA is generally high, usually the next step is referral to a urologist to consider prostate biopsy to rule out prostate cancer.
Okay, and that's a part I say.
Hello.
Count. Dr. Kayana, and no, a good. But Kakabio Horma Medibacano, the betting me, I'm making the major confirmation of the prostate cancer biopsy. Biopsy, the unya tissue, and so to me, a tissue at the collab. And my it me examine, it me almost me who this is a prostate cancer. Most of the times, I said they can PS and bet me across through. There are so many triggering factors here. A bet me the a bit me atrigama wo enzymes na say you need me akoso ye ba kwache ombokwa chicken na was one we catch us wo prostrate yade name ko na bia na enye no na bi kwa na ebi na your friends team obi ekura na ekoso that yi no but one hwe ye onkonya doctor pepe bi na wa mu na konta yi a obamu akonya say okonya your friends prostate cancer na akoye headache amount it most of times na dey so omunya tissue de bia enam na sa cancer ni tissue de mi omunya te no the collab no more examiner it's more 100% confirmation say this is prostate cancer mean my good treatment it me eboa me that's it.
Okay, yeah, that's it. I think our sister Cecilia want to say something.
Yeah, just for what's it called? I know he was saying like the best, the 100% is biopsy, but sometimes, as the doctor said, might be some risk factor. So that's why you will want to do a blood PSA. So if your blood PSA is low, then you know you're good. But if it's high, then you might say, oh, okay, it's high. It could be that I have prostate cancer. It could be so many things. So then that's when you want to consider taking a biopsy if you know your risks are high, like if someone in your family has it or not. But if you're scared of doing it because they have many so like, yeah, if you I know someone was saying like someone in their family had it and they don't like, they want to do it, but they don't want to do it because of the risk factor. That's where you can do the PSA. So when the PSA is low, the blood PSA, then you know you're good. But if it's high, then you can, see if you want to go do a biopsy because you know there's a risk factor in your family or, and yeah, that's what I want to say.
Thank you.
Okay,
I
yeah,
agree.
that's it. I'm saying that be a year na me be fi soldier ni no na so US military no be fi ma ye yo sa nema we ni nyina bi but first one I may doctor na kan PSA straightforward na no say yanko ba ko no do sa show any so no yeah you're very uncomfortable nya dia me encourage you bi so onye bi ntia we shall give what I'm saying I'm more whether than one answer seriously because sad test and then that's it. I say be any who be there near the addition of by the way unless you be was for the back.
Hello.
Hello.
Yeah, me
Yes.
short me kasa.
Yes,
Yeah,
ma'am.
na me busali say doctor ne can say enuanim no a etimi boa a say wo lifestyle wo start say wo di say enuane no a ebi ebetimi aboa na dia me pese me hu ni say me fan say bia onipa ko no ayi na large aye enlarge dada na say a wati asemi wo start say odi nuane no mo ti say broccoli ni cauliflower ne soya beans na enti ano no ebetimi a make difference kakra wo ewo na yinum ana ebetimi aboa ama niama ye stable a enkonko ye west a ebetimi ama aye balance na say obetimi live with that say wa start edi nuane a ebeboa no.
Thank you for the question. So those vegetables or foods that I recommended, they're more so suggested to help against prostate cancer and not, it's for prostate cancer and not for regular enlargement of the prostate gland. So that's the focus. At least that is how they were studied. They were more studied for helping or being beneficial in people who have prostate cancer, or the focus was on prostate cancer and not just regular enlargement of the prostate. So if someone eats those foods, I wouldn't say that you should expect your prostate to get smaller because you're eating broccoli, soybeans, or cauliflower. That's not the case, but so far the studies are more so suggesting that by eating those foods, it may be associated with prostate health against prostate cancer. In any ways, they are very healthy vegetables, and so I think any of us should include those in our diet, especially as men, because there may be a beneficial response to it. Thank you.
Okay. Yo, yeah, that when you say yeah, program no barrier, yeah, bringing the curtains down. And yeah, then you say, Doc, Ufana intake, what be my enough for there, yeah, running BBR.
Yeah, thank you. Again, the whole thing about the prostate and prostate cancer, again, it's a discussion that should be held with the primary care and the patient. It's a shared decision making. Once you reach the age of around 50, it's something you can talk about with the doctor. It doesn't mean you necessarily have to get it, but you should talk about your risk factors. You should talk about the benefits and disadvantages, and then together you make a decision together. Again, and then lifestyle habits are very important, as I said. Eating well, regular exercise, being active, some of the vegetables of broccoli, cauliflower that I've recommended, maybe soybeans. These are all lifestyle things that can help. I think one big thing for our population is that we need to engage in close medical follow-up at least once a year. As GHANAIAN, we should at least once a year have a medical checkup and be talking about all these things. Sometimes people from our population, we wait on things until things get too serious. So I think if there's anything else you all take from the presentations, that I hope you're encouraged to at least once a year have an annual checkup and keep a good relationship with your doctors. Make sure they know all your medications you're taking. The more you keep up with your medical care, it will help you in the long run. Thank you.
Thank you. It was a pass, Unya Brewe na Ode Adisha Sabre. Dr. Usu, Frank Usu, that was a Unya doctor, so then the Bray, Yame, Insha Munina. Yamisha, Safuma, Yenina, Naye, Yankoso, and Sum Yame, Yentan and Nana say, Yena Pedie, Yenanti. Dear Renisano, say announcement if you are penny betting the about a bini also the ane best said Fred. Now Bompire, the Yenina, Mensa, and the doctor and the bush and Sashin Mensa. In penny for announcement, we will hire a bit me about. Okay, any other Fred? If I show, Papa want to say, wow, how it's my Bompire, my.
Yo, me a one pay. So you know, that was there you want. I'll pay you my summer an army of one. Says a crystal kind one we shouldn't be afraid. And every so one somehow they are my fire pomodel that was a pa. Oh, Nipanoa, my area and canon. Tea on my chair. Why I before so a bit me prevent a area who do be pray. A doctor about a church. So, come on. You were a way blue. So as a crystal. Say, that was simple. Nim the other my doctor for my church and the beard I saw in a man so one in the mutim their church was suffering. In the bushia, a show and sa. Shrano. Dear old Biano, Christman and young son showed him. It is a for many now so show and sa for me, David. Sir, wound me, the beard, when you could know. Maybe I were to the own person by your own person whom be a better Tina than Timboy. Men's ministry, I don't want to say, we may dear in a day. Pemu ya ba beti to anim home dey ya kɔ ne wie yɛ Joe rehwim sɛ wa bɔ yɛ ho ban ɛka yɛ nyinaa bɔ mu home dey wo so ahwɛ yɛ so na waka yɛ ho opem sɛ ɛda dasana yɛbɛsan ahyia until then no yɛ nyinaa nsan ka Yesu Kristo dɔ konkwan yɛ nkofa na nko so nka yɛ nyinaa mmom sɛ nipa baako fo ma ɛtimi no waka me de onyi ne nyinaa mfiri hɔ ma yɛ kam so bepie wɔ ne monyam Yesu Kristo de mu nti amen.
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 Amen. And the Munja say, the Munja. Remember, no one to our dues last year, but more than that year, this year, so $30 per man. The Untia Yamionia and who treasure next year. And the Munja say, Yamini Munja Etna.
For just $67, you can make as many videos as you want, and you never
Papa,